Data from the CDC shows that in 2024, more than 2.2 million sexually transmitted infections were reported. Cases are nearly 13% higher than a decade ago, and the U.S. is still facing an STI epidemic. In 2025, new testing and treatment options, those were released to help people with the infections and help maybe lower the rates. Medical Director of the Mercy Health Laborist Program, Dr. David Bietz, joins me now to talk about the advancements that have been made in the last year. Doctor, thank you for taking the time.
Thank you for inviting me.
Absolutely. So the COVID-19 pandemic, it brought an increase in STIs. It also brought new technology for testing. The same used for those at-home COVID tests a lot of us used when we were sick. So those kind of tests are being used to test women at home for 3 different types of STIs. Which ones does it test for, and how does the test work?
Well, there's a new test out now that tests for gonorrhea, chlamydia, and trichomonas. And it's simply just a swab that you insert, and then it comes with a kit that you plug in, and then you get an app on your phone, and you get a result within about 6 hours of what it comes back.
And it costs about $150 and includes telehealth consultation with a provider that can discuss, maybe even prescribe some medication if needed. How does this new option help women who might not have an easy way to get access to medical care?
Well, I mean, there are women who either don't have insurance and can't get in, and sometimes there's barriers to getting into the office. So it makes it so it's a convenient way to just go to the store, get it done, and then you can get your results relatively quickly and then get treated.
Is it a faster process, would you say, compared to the traditional route of going to the doctor and waiting for those results to come back?
It takes about 6 hours compared to most physicians' offices now get you the results in about the next day.
Okay. In May, the FDA also approved a testing kit for HPV and new guidelines from the Health Resources and Services Administration. They say women ages 30 to 65 should be offered this as an option. Can you talk about what HPV is and how this test could maybe also lead to catching the disease even sooner?
Well, HPV is a virus, and it's sexually transmitted. Everybody has one form of HPV or another, but there's specific high-risk forms of it. And so what this test does is it tests you for those high-risk forms of virus, and it gives you an idea if you need to have more extensive workup for cervical cancer or for precancerous changes in the cervix.
And would you recommend the vaccine? There's one out there. I know doctors offer it to the younger patients too.
The vaccine, it works very well. It's recommended by the American College of Obstetrics and Gynecology for everybody. But the best way to get your treatment plan and everything is to see your doctor and come up with a comprehensive plan for you. I don't think any of these home tests or home remedies really take the place of having a physician to go over what your risks are.
And there's not been a new drug to treat gonorrhea in decades. In 2025, 2 did get approved, though. So can you talk a little bit about the difficulty in treating that, why these new drugs maybe are a big step in treatment?
Well, in the treatment of gonorrhea, we have some gold standard treatments, but there are some drug resistance, which have been a problem. And the problem with those drug resistance is to treat them, most of those are IV drugs. So even though this is not a first-line drug for treating gonorrhea, it treats resistance forms, and it's more convenient than going in and getting the IV version.
All right, great information, Doctor. Thank you so much for taking the time.